Hello, everyone. Today we're going to discuss a relatively common yet often unnoticed condition in retina called the peripheral retinal degeneration. Now, before we dive right into it, let's first talk about what the retina is. The retina is a very fine membrane that forms the back of the eye, which is basically the nerve of the eye. So all of the images that we see are reflected onto the retina. Now, the central retina or the macula is often examined quite at length, and the peripheral retina, which are the sides of the retina, tend to get overlooked. So today we're going to discuss why, when, and how we're going to examine these areas and why it's this important. So what exactly are peripheral retinal degenerations? Peripheral retinal degenerations are basically anatomical changes or structural changes in the sides of the retina that cause thinning and some kind of wear and tear in the retina. Now, these by themselves tend to be quite obscure and don't always require treatment. However, they could lead to something more sinister, like retinal tears. Now, these retinal tears are quite different from degenerations. Tears are actually breaks in the retina, and they can lead to what is called as retinal detachment. Now, that is a serious condition which would require emergency treatment. Now, this is a very important question because they are relatively common and often missed if you don't examine the retina dilated and if the retina is, say, not examined by a retina specialist. I would not say that everybody needs to be concerned about it. However, there are certain high risk groups. Aging individuals tend to be prone to peripheral retinal degenerations and very often tears as well, because the jelly of the eye tends to separate from the retina as we age. Whereas in a majority of people, it happens quite obscurely. Some people, it could leave back sequelae like holes, which then would require treatment to prevent retinal detachments. People who have high minus powers or myopes tend to be more prone to these kind of conditions. Also, if you say had a family history of a retinal detachment, that would put you at a higher risk of these conditions. And the unfortunate part is these things do not have any symptoms unless you develop an acute tear, in which case you will have some symptoms like, say, flashes or floaters. But otherwise, unless a routine peripheral examination is done, these conditions tend to be missed. So if you are in any of these high risk groups, make sure you go ahead and have a peripheral examination regularly and follow up as per the instructions of your physician. Now, like I talked about the symptoms earlier, the symptoms are flashes, which are little sparks of light that are seen even in low light conditions. They look like little lightning beams in the corner of your vision. You could see an increase in the spots in your vision, often called floaters. Now, everybody tends to have few floaters, and these tend to be obscure usually. However, if your floaters dramatically increase, or if they increase in shape, size, or number quite suddenly, that is when you need to be concerned. So that would be a red flag. Also, sometimes some people present with a curtain-like appearance in the corner of the vision, or sometimes even distortions in visions. Now, as discussed the risk factors previously, aging is a risk factor, and none of us can escape that. Myopia, which means high minus powers. If you've ever had an injury in your eye, if you've undergone ocular surgery previously, if you have a family history of retinal detachments or peripheral degenerations progressing sinisterly in your family, then that would be something to be concerned about. So those are things to look for as well. Degenerations like lattice degenerations, to name a few, are basically just thinning or consider a frayed fabric. It's like fraying of the retina. By itself, it doesn't have too much problem. But if these conditions were progressive, say they developed holes, or because of the separation of the jelly from the retina, if they developed a tear, that would cause fluid to travel from the jelly of the eye and into the undersurface of the retina and lift the retina up. Now that would be a retinal detachment. That is something that requires surgery, and that would probably require quite urgent intervention, or it could be vision threatening. Usually, if it's a trained eye, a dilated examination is more than sufficient to diagnose peripheral retinal degeneration, tears, breaks, anything of this kind. And that's why we insist on having regular examinations. However, other ways to check would be also to have a wide field retinal imaging if that is accessible. Or in some cases, say you have a dense cataract where we say the media is hazy or something of that sort. We could pick up early subtle changes with an ultrasound maybe. However, just thinnings of the retina cannot be picked up by an ultrasound, and that would require actual physical visual testing. What are the treatment options? Now, the treatment options include the commonest being laser. Now, say you had a hole. This laser is akin to welding, I would say. The laser spots are placed all around these particular tears or breaks or holes, and that prevents the fluid from traveling under these holes and lifting the retina up, thereby preventing retinal detachment. Another less common or rather previously used technique was also cryotherapy, where a cold probe is used to create an adhesion between the retina and the choroid, or rather cause them to stick back tightly together, preventing a retinal detachment. Some lifestyle changes that you could make is to make sure that a retinal examination is part of your regular ophthalmic testing, which means that you need to have a dilated examination and preferably insist on it if your treatment of your practitioner does not offer it. A second thing would be to keep in mind that if you are at high risk, make sure that you do this examination at least once a year, even if you are not symptomatic. Point number 3 would be if you do develop symptoms, make sure that you go and have your testing done ASAP. So these are the things that you could do from your side to actually prevent complications from peripheral retinal degenerations. I hope at this point that most of us have understood what a peripheral retinal degeneration is, how important it is to actually have a test done once a year at least, or as guided by your physician, and how this particular simple test can prevent vision threatening complications. Thank you.